Welcome to Basically Physio, guys. Today in the stroke rehab series, we'll be talking about knee hyperextension during stroke gait. This hyperextension manifests in the form of locking during the stance phase of the affected leg, as you can see here. As a result of the knee hyperextension, it can actually cause the stroke survivors to use more energy to walk, which can actually mean that they fatigue out faster as they go along the distance. This hyperextension also reduces the symmetry between the good and the weaker leg, which ultimately means that the gait is inefficient. Lastly, it can actually cause knee pain. The reason why this can happen after a stroke is due to limb weakness, lower limb spasticity, a limited ankle range of motion, and some proprioceptive issues. When the knee is weak, it usually means that the lower limb is weak also. This can actually mean that the quadriceps and hamstring muscles are not able to co-contract during the mid-stance phase of the gait cycle. Hence, a safer way to actually walk would be a passive locking strategy, which is actually seen as a knee hyperextension. In spasticity, the ankle tone is usually affected first. This would mean that the dorsiflexion range in the ankle is actually limited. This can actually show in the knee hyperextension because when the mid-stance phase happens, the knee is not able to go bypass the foot, and hence it will actually lead to a hyperextension in the mid-stance. When there are issues with proprioception in the lower limb, it usually means that they are not able to feel the lower limb accurately, and this would actually lead to a difficulty in controlling the lower limb during the stance phase and the swing phase. And during the stance phase, this can show up as a knee hyperextension. So how can we train this? You can actually break it down into two steps, which is to train the stance phase. This actually means you need to verticalize the patient and you have to bring them into a standing position so that it will actually stimulate the quads and the hamstrings to actually fire up. The next is you need to train the co-contraction during the mid-stance phase, and this actually means that you need to get the quads and the hamstring to work together in the mid-stance so that the knee does not collapse or go into hyperextension.